Good evening, everyone. Let me welcome all my viewers once again today on Heart Mitra. It's always a pleasure to be talking to you, interacting with all of you, and talking to about subjects which matter the most for the cardiac health. Heart Mitra is created for all of you so that you are updated on a daily basis with the relevant scientific information, which is reliable, and also to interact with you. We invite leading cardiologists from across the country who can talk to you as a friend and answer the queries which you have in mind. Today, I'm very glad to welcome Dr. PLN Kapardi from the city of Hyderabad. Sir, welcome to the show.
Thank you, Mr. Sanjay Mehra, for welcoming me.
Yeah, it's pleasure to be hosting you, sir. We get a lot of queries from our viewers. They keep on putting chats, and one of the topic which people want to understand is that there's so much of media glare. We keep on hearing that cardiac issues, especially heart attacks, are happening at a younger age group, and many people face this. And if celebrities face it, then it becomes it goes viral and on the media, and a lot of people get worried about it. So today, sir, we'll seek your expertise to learn about this. But before I, move on to taking the questions for my viewers, let me formally introduce Dr. Kapardi to all of you. As I mentioned to you, is one of the leading lights in the field of cardiology in our country. After completing his master's in medicine from Vijayawada, he moved on for his super specialized training in the field of cardiology from prestigious PGI Chandigarh. And way back in 1994, he completed his training from there. Uh, Past 3 decades, he's been serving his patients with the cardiac issues. He's also having fellowship of majority of national and international academic bodies, and he is considered to be an expert in various complex cardiac procedures, including the radial interventions. And he has performed till now more than 10,000 radial procedures, including angioplasties, and many publications he has in the medical journals. So we know that we're talking to an expert today who can answer all your queries. Sir, let me straight away, get you in, and if you can, highlight to our viewers in your opening remarks, like how big is this problem when we talk about cardiac problems happening in the younger age group? Is it really an issue, and what percentage of your patients will be of your cardiac patients would be, in the less than age group of 40?
Yeah. Thank you, Dr. Mr. Sanjeev Mehraji, for warm introduction. And the most important things, first of all, at the outset, I'm thankful to Heart Mitra, this Facebook, for giving this opportunity of public education. And most important, our India is going to become a hub of heart problem in future. And already we know maximum number of diabetes, especially type 2 diabetes incidence in India. And now the next important is this heart attack epidemic will be there in India. The most important incidence, if you take in next coming, 1 in 5 heart attacks suffering from the patients will be an young person less than 40 years of age. This is the most important bothering issue. And second important is in India, the incidence is so increasing next 2 to 3 decades. Maybe the incidence of heart attacks in young may be 20%. That is the probabilities that the incidence is increasing. As we know, if the heart attack is occurring in normal persons, it won't be a news, but it is occurring in celebrities like Puneet Rajkumar or some MLA son or MP son, then it becomes a big issue in heart attack occurring in young persons. Normally, as per the medical terminology, young means less than 30 years. It is called very young. Of course, the young is less than 40 years of age. This is important because normally, routinely, the metabolic problems like diabetes, as well as cholesterol, high cholesterol, and heart problems, the incidence occurring between 40 to 65 years age. But in young patients, means less than 40 years, if heart attack will occur, that is called a young heart attack. If it is less than 30, it is very young heart attacks. This is important understanding. These are incidents. Most everybody should understand. And the second important thing is what are the risk factors which we should know? Why the incidence is increased in India? The most important, this is a lifestyle related disease. Basically, the heart attack is a lifestyle related disease. You should understand. That means the lifestyle means our dietary patterns. Second one is our physical activity patterns, and third one is our psychological phenomena, whether stress related. All these things are important. Your relaxation techniques, entire thing, and habits. These four constitute the lifestyle. So, whenever their dietary discipline is there and healthy diet patterns, especially vegetables and all these things, and consumption of fruits is there, then okay. But once the lifestyle is westernized lifestyle or a modernized lifestyle where the dietary discipline is lacking, and apart from the breakfast, lunch, and dinner, once you are taking the nighttime also, that is a culture, especially in the cities, and weekend culture, especially weekends, you are taking lot of high energy, high processed diets you are taking. So all these are the ultimately contribute to the metabolic ill health, where the high sugars, early occurrence of diabetes, and early occurrence of high cholesterol, all these, along with the overweight, that is obesity, with increased body mass index, is happening, and ultimately cause damage of the vessels, especially the heart blood vessels, causing the bad, that is damage of the coronary blood vessels, and damage of the brain blood vessels, as well as the kidney blood vessels. All these, that means vascular health is becoming affected, and this is most important. Our diet will determine our metabolic and vascular health. And second important is the physical activity, that is also lacking nowadays because of the sedentary lifestyle and mechanized lifestyle. And that's why, to create awareness, the 100K run or 1000K run, like that, it is increasing to create the awareness. And the third important thing is everything is nowadays is modernized. Time is a time and target related, which builds up the stress. And ultimately, stress is body to the back to our health in terms of it increase the clotting capacity of the body. So that's why that itself is a thrombogenic, the stress itself. And apart from three, the sleep wake cycle is becoming disturbed, and the nighttime wakening and daytime our day-to-day activities, all these sleep span is reduction is also one of the important factors of contributing to the young heart attack with high clot forming tendencies. So this is important. In conclusion, the lifestyle is more and more important, and ultimately leads to the heart attacks in young patients. And apart from that, the important habits, that is tobacco in any form, chewing form or smoking form, and the excessive intake of alcohol or drugs also, that produces the clot forming tendency and cholesterol blocks in our heart blood vessels, starting the young heart attacks. In my experience, the youngest heart attack I have ever seen is a 12 years boy from Vizag. We have seen the youngest person. And of course, the commonest risk, apart from the lifestyle, that is risk factors, the most important contributing factors in brief are smoking, especially the tobacco in any form, especially smokers. The highest influence of young population, they are getting this type of heart attacks, as well as strokes also, and hereditary also contributing almost 20% of young heart attacks is caused by hereditary, that is family history, strong family history, where the cholesterol is very, very high. Normally, the total cholesterol is within the range of less than 200, and LDL cholesterol will be less than 100. But in this hereditary history, the total cholesterol will be almost 300, 400, and LDL, which is considered to be bad cholesterol, will be almost 200, more than 200. So these are the major two important brief causes of the heart attacks in very young or young people, that is less than 40 years as per our Indian standards are considered. So
Okay.
having all
So,
the, yes sir, please.
yeah. So I think as Dr. Kapardi mentions that there is, it is a problem at hand we have in our country that more and more younger people are getting cardiac ailments. And he also talked about the general risk factors and the reasons why this is happening. And he emphasized on some of the things like, that more people are having diabetes, lifestyle modifications, lifestyle issues have been there, family history, and multiple, reasons he mentioned. So, which means that we should be careful and be more cautious about. Don't think that a cardiac ailment will probably come only at an age of 60 plus. It can come early, and therefore we need to be more cautious. And today's program objective is this, that we are able to discuss more deeply into this, so that we are more aware and more empowered to manage it. Sir, you talked about the general reasons, Dr. Kapardi. Are there any specific, group of individuals who may be at a far more higher risk as compared to their other colleagues, so that they can be little more cautious? If you can help us understand.
Yeah. So this is most important. We have seen especially high executive professionals as well as IT professionals where the lifestyle is becoming totally altered. We have seen actually where night duties will be there, and nighttime eating will be there. All these things will ultimately cause altered lifestyle and increased thrombogenic tendency, that clot forming tendency. And apart from these, busy executive professionals where the time and target stress will be more with lack of physical activity. And nowadays, because of the availability of the high processed, high energy diets, and these all these are contributing to our bad metabolic health in younger population. And another important in which in the real world compared to theory is smokers especially. You have seen smokers, it causes the vascular damage in all the aspects, cholesterol accumulation, clot formation, and dissections of the blood vessels. And most important is clot forming tendencies will be more and more in smokers we have seen. And that's why if any person having any tobacco habit means we have strong advice that we will ask them to stop. So these are the groups which are highly prone for developing the heart problems.
Okay. So as you heard, so if you have any of these things, or you go through such schedules in your lifestyle, I think you can be at a higher risk, and nothing to be panicked about. But then just the moment that you are aware that you undergo these things, one can be more cautious and take care of that. So now if there are people who are at higher risk, what they should do? Are there any early signs and symptoms which they can pick up, so that it gives them a signal that okay, something may be wrong, and I need to go and talk to my doctor and meet him early.
Yeah. Yeah, this is most important. Everybody should know, so that whenever these symptoms, they should alert them to have a early checkups. The first and foremost important is any discomfort. Usually, 70% of the people will get the discomfort in the central portion of the chest. That is a almost vajan jaisa hota hai. That is the description classical, or some peculiar sensation in the central portion of chest with left hand dragging sensation of the left hand pain. And if these symptoms with sweating means there's strong suspicion somebody is going to develop the heart attack. And in remaining 20 to 25% of people, atypical symptoms also occur, like burning sensation of the abdomen and burning sensation of the chest and dragging sensation of the both hands and any throttling sensation of the neck. Gardan mein guttan si sensation like that. That is a classical description. And apart from these, lower jaw pain and tooth pain, and in some people, depending on their body constitution, they develop just a breathlessness, mimicking like a lung problem, Jason. These are all the symptoms are more important. They should alert any symptom from the umbilicus, novel, to the lower jaw. We have to religiously go to the cardiologist nearby or their family physician and take objective tests, and then if it is there, you have to take timely treatment will save them. If it is not there, everybody will be happy. So these are the warning symptoms everybody should should be keep in mind. And another important, especially in diabetic population, very important, because nowadays even diabetes occur in young people like 25, 30 years also. Our family history, if it is positive, if apart from these symptoms, just sometimes silent problems are also more common in terms of fatigue or in terms of giddiness and syncope or excessive fatigability and excessive breathlessness like symptoms. For atypical symptoms also should raise a suspicion, and they should go and take the consultation of their family physician or a cardiologist.
Okay. No, I think this is very, very vital. And as Dr. Kapadhi has mentioned, if any of these symptoms you pick up, don't ignore them. These can be fatal. Immediately go and meet your doctor. Sir, what is the role of early screening? At times the symptoms you told. Now these are some of the things which will come at a very. They will be very acute in nature, and
Yes,
probably the heart attack is already setting in, and then
yes.
it's an emergency situation. But do you recommend to people who are under high risk that they should do certain kind of annual screenings? If yes, then at what age they should initiate the screening, and at what frequency the screening should be done?
Yeah. So this is most important, especially in the presence of the bad lifestyle or risk factors background. Definitely, screening plays a significant role in early detection. As we know, prevention is better than a cure. And then the screening tests nowadays, very important tests are evolving, including modernized tests. The traditional tests like ECG, where the electrical activity of the heart will detect whether patient is going to develop or not, and echocardiogram, where the heart muscle and valves are functioning well or not, or any silent heart attacks it can detect. And the third important is a treadmill test, where exercise ECG, whether exertion, the blood supply to the heart muscle is adequate or not. Apart from these traditional tests, the modernized tests are like a troponin I, that is a substance which is leaked to the blood whenever the heart muscle is devoid of the blood supply. And apart from these, nowadays the CT coronary angio plays a significant role in the presence of risk factors background. So any risk factors background which I described, if the person is having, then definitely they should undergo structural evaluation. That means how is their coronary arterial health in terms of the coronary artery calcium present or not, or by means of CT angio, whether cholesterol blocks or some calcium blocks present or not, it will detect. And functional evaluation by means of treadmill test, where the blood supply to the heart muscle is adequate or not. So this constitute a important role in detecting the coronary artery, that is the heart problems in early stage. And apart from metabolic health is also important. That means you should have the fasting post-lunch blood sugars as well as HbA1c, and a lipid profile, fasting lipid profile, where how is the distribution of his bad cholesterol LDL, and triglycerides, that is also one of the bad cholesterol, and good cholesterol like HDL, how is their patterns which can detect, so that metabolic health also there is an opportunity to correct.
Hmm. Okay. So then the test, so which you have told, and as you rightly mentioned, that these tests can help the doctor identify if there are any early signs and symptoms, and then the patient can be guided. But at what age, patient should go or individual should go and get himself screened, and what's the frequency? Like, should be done yearly or once in 2 years? Like, how it should be done.
So this is important. Actually, the most important I can recommend for Indian setting, normally routine from 40 years age onwards, screening test will be advised. But Nowadays, where the metabolic ill health is prevailing, apart from the risk factors, definitely from 25 years onwards, everybody should undergo the health checkups. But every 5 years, the risk will change. The development of the coronary block, that is called atherosclerotic cardiovascular disease. This is the medical terminology, ASCVD, atherosclerotic cardiovascular disease risk. So that risk will change every 5 years. So everybody should undergo these CT coronary calcium and CT angio every 5 years, and every yearly metabolic parameters like sugar profiles, cholesterol profiles, and eco TMT. These are the things which every yearly annually has to check, especially for high risk young population who are strong, persons who are having strong family history, those who are having young diabetes, and those who have high cholesterol levels, and those who have habit of tobacco habits and alcohol habits. They should undergo every yearly the metabolic parameters health, as well as the ECG echo TMT, and every 5 years they should undergo these coronary artery calcium and CT angio, because the risk will change every 5 years.
Okay, so I think here you hear an expert that at what frequency and what kind of tests you should undergo to identify early. So you emphasized now a lot about the lifestyle modifications in young individuals, because that's one of the major cause as well of getting the disease. So can you help us understand, sir, which are the major 3 4 lifestyle interventions someone should make if he falls in a higher risk group, and also during the testing some early signs have been picked up. So what are those 3 or 4 lifestyle modifications you advise to your patients?
This is most important, pertinent question, and every high risk young individual having risk of coronary disease should follow. The first and foremost is diet. That is most difficult because that is the age of temptation for everybody. Usually diet. So they should have a balance. I think so. The most important is the plant derived the foods are very hot user friendly diets, like vegetable salads and fruit salads, and I think in lunch and dinner 50% of portion should include the fruits and vegetables, very important. Remaining 50%, they should have a most protein along with the medium carbohydrate, that especially the whole grains, fiber related with carbohydrate rather than the processed diet. For example, whole grains as well as the leafy vegetables. These are the important incorporated in the diet, along with the fruits which contain a lot of antioxidants which are protective to the heart. And whereas processed diet, better, very limited you have to take, and dairy products like milk and milk related products which contain saturated fat, also you can have a limited content you have to take. And you should have a dietary discipline, to be frank. Instead of 3 times you can have a 2 times diet, and 50% should include the plant, that is vegetable salads or fruit salads, and incorporation of the physical activity into your day-to-day life, apart from the 30 minutes walk or 12,000 steps per day. So this is the keep your body physically active, that will improve your metabolic health as well as protect the vessels. And third important thing is the relaxation techniques like meditation. Out of all, of course, depending upon their likes and dislikes, they have a relaxation like music, or watching a TV, or music, listening, or book reading. But the best relaxation technique is meditation. As we know, the India that is contributing the International Yoga Day, that meditation plays a significant of the best relaxation. I think from the yoga teacher we should learn, and 15 to 20 minutes you have to spend for their mental relaxation, so that your psychological health and stress will be buffered, and it will be diluted. So these three we have to incorporate, apart from stopping of the habits like tobacco, stopping smoking or chewing, and alcohol also. I think stopping is better than the limited control, because once we start, they have no control, and the excessive alcohol is one of the important contributor to the metabolic ill health and the vascular ill health.
Hmm. Okay, so I think very clearly three things he emphasizes: manage your diet, and I think Dr. Kapadia has helped us understand that how do we modify our dietary habits. Second is exercise activity level, and he again clearly mentions half an hour daily, 12,000 steps, and some of the other things in activity. And third is managing your stress, psychological pressure, very important. So get these three things right, and probably your
Another
risk would
important, a small,
significantly.
sorry to interruption, a
Yeah.
very small thing which I have to add here, because which we have seen 1 year, 2 years back, the excessive exercise will causing the sudden cardiac deaths. Very important is whenever you want to start the exercise program in young population, first they should have a structured treadmill test, where during your exercise test, they will observe your BP responses, pulse rate responses, ECG responses. All these comprehensively we'll see during the treadmill test, so that so the what are the do's and don'ts during your exercise program when you want to start the physical activity. The doctor will supervise, and cardiologist will give an exercise program that will protect to prevent sudden cardiac deaths also, which is unmonitored excessive exercise.
Sure. Again, I think a good highlight, and a point emphasized there. So let's go a little more, practical into it. And you talked about stress management, psychological pressure management. Now, let's take a young professional these days, about whom we are talking. He's a 35-year-old guy from a good, technology institute. He has passed. He has taken up a job 4 5 years into it. There's a lot of workplace competition he faces. He has to be better than maybe his co-worker. There is a lot of stress he faces. There are timelines he has to manage. Then, in such a situation, how the stress can be managed. Out of your experience, what's your advice to people who undergo this?
This is a very important question, which is very difficult. Everybody has to balance. The most important is the stress management. Whenever it is scientifically proven, also, once you learn a meditation from a yoga teacher in a structured way, like they will tell that transcendental meditation, of course, in different varieties like Kriya Yoga, Raja Yoga, there are different yoga they will mention. If you do the transcendental meditation, your vagal tone will increase scientifically, and your sympathetic, that means the body reaction to the stress will be minimized. So once you do this transcendental meditation from a yoga teacher, then automatically your management of the stress during your workplace, in your domestic domains, and apart from these, in other areas also, either financial stress or a job stress or domestic stress, you can have uh, that capability of the managing the stress, and the stress effect on the body will be minimized. Once you do regularly the meditation with almost 15 to 20 minutes, your vagal tone will increase, and your body reaction to the stress will be minimized. That means normally whenever a person become exposed to the stress, what happens is his pulse, BP will rise up, and his clotting capacity of the blood will increase. Everything will become a negative way. So with this transcendental meditation, that body reaction to the stress will become modified, so that these untoward things won't happen.
So meditation, yoga, some of these things will help you maintain your cool and manage the stress levels, our traditional ways. But so a lot of people take on some of the modern ways of stress management. It is felt. We see a lot of people Friday evening, so they will open up Netflix or something, and there's concepts like binge watching, binge eating. They feel that 5 days they have worked hard, and now for 2 3 days they need to do all these things to release the stress. So does it
Yes.
really help reduce the stress, or is it a burden on their medical or health? What's your view on this?
It is a blessing and disguise, I think. For example, actually, what we are thinking of relaxation is not a true relaxation. It will produce agitation in our body, to be frank. Suppose once you want weekends, you want to go to some music concertanium like that, where instead of relaxing music, you are producing a highly echoic music. Then your body response is totally different. You develop high heart rates, high blood pressures, all these things will occur. So that is one. And second is what our mindset usually in the especially city culture. Weekends means we can have a good food and all these restaurants. So where we are doing a little bit going a unhealthy side, where we are taking a all in brief we can tell all tasty food is bad health to the body. Actually, to be frank, they are nothing but a processed diet, and it's a high carbohydrate diet and high fat diets, which ultimately produces a lot of metabolic untoward changes in our body in terms of increasing our cholesterol, increase our sugars.
Hmm.
And of course,
Okay.
we should maintain a balance for this. All tasty foods you take a limited amount, all untasty foods you can a bulk amount, usually. In brief, you can tell. Especially plant derived diet is always healthy.
Hmm. Okay, so I think some of these things which we feel, this binge watching, weekend bashes, they are probably not the stress relievers for you. They will only add on to the health burden which you
Yes.
already may have. So once in a while, okay, but I don't think so that Dr. Kapardi advises any such thing to people who are at high risk. So now, God forbid if someone has, got this cardiac disease at early age, and there is the event also which has happened, someone has undergone a mild heart attack or let's say a major heart attack, then what? Like, do we have the right kind of medications available with us today? Or, do we have any new advances which are there which can manage that individual, still live a healthy and, a long life like anyone else?
So this is most important where we need some lot of awareness. For example, until once we extrapolate, you can understand a better way. Suppose, for example, Mr. Puneet Rajkumar. Basically, he is a very athletic habitus. If you carefully observe his cinemas, he will not fight directly. He will just a somersault moment, then he will fight. So that means lot of physical activity will do. So naturally, what happens is once like that of physical activity, we can develop a false feeling that we won't develop heart problems. Such a physical active person, but it is not true. The most important is whenever warning symptoms, as I told previously, is there from umbilicus to the lower jaw, immediately we have to go to the our family physician, a cardiologist, and take one ECG, and whether the changes are present or not. Suppose if changes are present, we can should receive a immediate treatment. That is because time is the muscle. It is called golden hours in the management of heart attack or strokes. That means paralysis. The golden hour should be there. In that golden hour, if you salvage the person, automatically the muscle will be protected and brain will be protected. Suppose first 2 hours is the golden hours. That's why once you get the symptom along with the sweating, you have to rush to the hospital, take ECG. Suppose if ECG confirms heart attack means immediately nowadays the primary angioplasty that is called, where the doctors will immediately take to the cath lab and then check the angio, and wherever the blood vessel was blocked with a clot, they remove the clot, and then immediately we put a stent so that his heart muscle will be preserved, and will be come out of the danger. Suppose if we neglect, what happens is the heart has a two important functions. One is the electrical, rhythmically contraction, electrical pulses convert into mechanical pulses, so 70 to 80 per minute. And second is the blood circulation. These two become hampered if we delay the treatment. Actually, if he comes to the doctor itself, he's delay more than 6 hours, 12 hours. What happens is a sudden cardiac death because of the electrical disturbances and sudden cardiac asystole, or the heart, the pumping capacity will slowly comes down and ultimately leads to the suddenly fall of blood pressure, and he will go into the shock state where the blood supply to the all the organs become insufficient, and ultimately will succumb to the multi-organ failure due to the cardiogenic shock. So these two are the dreaded complications of the delay in the management or delay in coming to the doctor. And majority of them we think because we are young people, this might be a gastric trouble, they will think, and they will come late to the doctors. Very important. So that's why whenever a morning symptom is there, background risk factors is there, immediately going and taking ECG. And once if it confirm is, timely treatment is important in terms of the primary angioplasty, which saves the lives, lot of lives actually. We have seen yesterday only, just day before yesterday, 30 years person having a holy, having a alcohol binge, and immediately he had a classical chest discomfort, came ECG showing, and we did a primary angioplasty, and patient was survived. And today is
And for
having
these patients, sir, who reach you in time, they pick up the symptoms early, and they either undergo a procedure or they are put on medicines. So,
yes.
can they live a long and healthy life post procedure? Are these like easy and assured of? Because early happening an event early means more number of years to be managed. So the one
Yes.
of the big psychological pressure is that my life would be cut short. So what's the reality? Like if a patient reaches the doctor timely, he is in constant touch with the with his doctor, then can he live a long and healthy life post event as well?
Unequivocally, once the patient survive, there are a lot of secondary preventive drugs are there nowadays. The first and foremost is the beta blocker drugs like metoprolol or bisoprolol or carvedilol. Second important is the blood thinners like clopidogrel, ecosprin, ticagrelor. These are the molecules. And third important is statins. These are the wonder molecules of the which prolongs the life, especially rosuvastatin, atorvastatin. Nowadays, non-statin related cholesterol lowering drugs like bempedoic acid and ezetimibe. So these are the panorama of drugs which prevent the recurrent events of the heart attacks and prolong the lifespan. And apart from the revolutionary drugs are also there, especially to correct the metabolic health in terms of the semaglutide. That is a wonder molecule which reduces the weight, which have a cardiovascular protection. And the new cholesterol lowering drugs like evolocumab, that is a monoclonal antibody to the LDL receptor. And another important is a vaccines like thing, cholesterol reducing vaccines like thing, uh, like inclisiran. So these are the panorama of molecules are coming, especially in young population where the cholesterol is attributed and clot is the attributing factor for the heart attack. So to attack the clots, newer blood thinners are coming, including these Revaroxaban, newer oral anticoagulant drugs. And to reduce the cholesterol, newer vaccines are also available. I think you have to appropriately apply these drugs to the appropriate situation, younger patient, so that they can lead a normal lifespan, and they can have normal longevity, provided they should follow a good lifestyle. As I told, diet, physical activity, and cycle relaxation techniques, sleep-wake cycle maintenance, avoiding the bad habits, smoking and alcohol, and religiously taking these drugs, beta blocker, blood thinners, and statins.
Okay, so in nutshell, I think there are a lot of medical solutions which are available, a lot of newer developments which are happening, as Dr. Kapardi mentioned. So, but you need to be disciplined yourself. You need to be in touch with the doctor and following his or her advice. If you do that, then I think, as Dr. Kapardi says, that one can have a long and a healthy life even in this situation. So, since we're running out of time, just one final question I'll take. The
Yes.
purpose of Heart Mitra and doing some of this program is making people aware about and empowering them by making them aware. I just wanted to understand, sir, that in current days, as a cardiologist or as the hospitals, the major hospitals, how you are taking up your social responsibilities in educating the masses or educating, especially the younger population, productive population who is at higher risk. If you want to, highlight a few things to us.
Yeah. First of all, I should be thankful to Heart Mitra to give for giving this opportunity. And most important, as a cardiologist, my social responsibility is there are three to four ways of reducing the heart attack incidence in the society. The first and foremost, like Heart Mitra, this foundation through Facebook, we should convey this message to the common man. That is number one. And second is we ourselves conducting the camps for creating this awareness. And so many lot of social media, they also should convey this message to the common public, and so that even one person if he follows, especially regarding the lifestyle management, primary prevention, secondary prevention, and tobacco stopping. So then we can save a lot of lives. And by following these important preventive measures as a responsibility, we can reduce the heart attack burden in the society.
All right. So on that note, I must thank you, Dr. Kapadri, for taking out your time. I must thank all my viewers who watched us live or who would be watching this program later on as well. I think it's very, very important points which Dr. Kapadri mentioned. So it becomes a social responsibility for all of us. If you watch this program, you find this discussion useful, then share the link of this discussion. If you have anyone in your friend circle, in the family, who has family history of cardiovascular disease, who has diabetes, or some of the other risk factors which Dr. Kapadri mentioned, just you can simply share the link of this program with them, and this discussion, this conversation can be life saving for them. If you yourself are young and go through those things which we discussed, it will only be apt that you follow the advice of your doctor, or as Dr. Kapadri mentioned, and and remain healthy and be safe and be productive in your these years. So with this, I will thank all my viewers today. Dr. Kapadri, I must thank you as well for coming over and sharing these thoughts with you. If you are in the city of Hyderabad or anywhere, in Andhra Pradesh, Telangana, you can always visit Dr. Kapadri in case you need more advice. He is at Care Hospitals, Banjara Hills in Hyderabad. But if you are in some other city far away listening to this, as he mentioned, don't overlook those early signs and symptoms, or some of those risk situations, and immediately meet your nearest doctor who will be able to help you. Thank you so very much, Dr. Kapadri,
Okay.
for today evening's program.
Thank you, Mr. Sanjay Maharaj.
Good night and bye bye, everyone.